Good morning, dear students. Today we discussed about some introductory portions of pharmacology practicals. So, sources of drugs. What are the main sources of drugs? We know this the natural, synthetic sources, and mainly these natural sources are plants, animals, microorganisms, minerals. These are the some natural sources. So these plants are the most well-known oldest drug source. So here given some examples of plants and their active principles, that is clove. This is the clove oil. This mainly obtained from the plant clove. This parts used this flower. This shows the pharmacological action. Another one is alkaloid plants are Digitalis purpurea and Atropa belladonna. Here this the parts used leaves. These leaves of this plant shows the active pharmacological actions. These drugs are digoxin and atropine. Cinchona is another alkaloid plant. This mainly used part is bark. This gives the anti-malarial drug quinine. Papaver seminiferum is another alkaloid plant, and the seed capsule of this plant gives the morphine, is a well-known opioid analgesics. Next, natural sources animals. For examples like this, from pancreas we can obtain from insulin, thyroid extract from thyroid gland, and cod liver oil from fish liver. Next source is microbes. This is the microbiological organisms. This is the main natural source. For examples like penicillin. Penicillin this mainly obtained from Penicillium notatum. Bacitracin, this Bacillus subtilis. Examples of virus sources like this vaccines like polio vaccine, hepatitis vaccines. And the important source is actinomycetes. This mainly this stobramycin is obtained from the source Streptomyces tenebrius. Next source is minerals. These are some examples of mineral sources. Ferrous sulfate. This mainly used in case of iron deficiency anemia. Magnesium sulfate is a naturally occurring mineral. This mainly used to control low blood levels of magnesium. Aluminum hydroxide, mostly this aluminum hydroxide, magnesium hydroxide, all are these used as antacids. These mainly relieve heartburn, acid indigestion, upset stomach. This is mainly used in case of peptic ulcer, gastritis, esophagitis. This liquid paraffin, this mainly used in pediatric laxative. This is mainly useful in role of constipation. This also used in face creams, paste. This act as a good moisturizing quality. Next source is synthetic sources. Nowadays, most of drugs obtained from synthetic procedures. For well-known example, this most common one is paracetamol, aspirin, diazepam, anticonvulsant drugs. Most of these drugs obtained from synthetic sources. Biotechnological product, these are the newer techniques. From these techniques we can synthesize drugs like this human insulin, growth hormone. This mainly obtained from this genetic engineering method. Next we come to this routes of drug administrations. What's the aim of these routes of drug administration? This is helpful to measure the required amount of drug in a syringe using aseptic techniques to administrate drugs through subcutaneous, intramuscular, IM route. This is the various routes of drug administrations, mainly categories is parenteral, enteral. This all these injections comes under parenteral route, and enteral route, that is for this oral routes like this tablets, capsules, all this comes under. Another important route is the topical. Mostly these drugs administered on the skin or mucous membrane. These topical routes like these ointments, lotions, gels, and its next is rectal administrations through the rectum, the suppositories, enema, mostly administer. All these advantages, disadvantages of examples, all are we discussed in our theory class. Here is asking some the examples of some group of routes. examples of topical route was the main site of topical route administration. This administered through skin or mucous membrane. Examples are nitroglycerin ointment, metronidazole jelly. These are the some examples. Oral route, this mainly capsules. Capsules mainly categorized as soft gelatin and hard gelatin capsules. In soft gelatin, this drug substance are in oil or liquid form. In hard gelatin, drug substance are inserted in solid form, and this the outer surface is mainly cover of the gelatin shell. Examples of capsule are amoxicillin, tetracycline. Tablets are aspirin, paracetamol. Entry coated tablets. First, the entry coated is a special coating with this keratin, cellulose, acetate, phthalate, gluten, and some anionic copolymers of methacrylic acid and its esters. This is a special coating. This coating is not dissolved by the acid juice of the stomach. The purpose is mainly to avoid the gastric irritations, alteration, disintegration of the drugs in the stomach, and get sufficient concentration in the intestine. This is the main aim of this entry coating. Is a special coating. Examples like this diclofenac sodium, dulclax sodium tablets, erythromycin tablets. These are some well-known examples of entry coated. This is helpful in case of gastric irritant drugs. Next we come to this the parenteral route. All these injections are comes under this parenteral route. Examples of inhalation route. This is the general anesthetic salbutamol. This salbutamol mainly used for this bronchial asthma. Injections intradermal. Here this intradermal drugs are administered on the outer layers of skin. Mostly for vaccine administration, this one is the very preferred route, intradermal route. Example BCG vaccine, smallpox vaccine. Subcutaneous route, here these drugs are injected into subcutaneous tissues. For examples like insulin and testosterone. Intramuscular, main site of intramuscular administration, drugs are injected into large skeletal muscles. Examples penicillin, morphine. Most of these antibiotics are administered. And intravenous, these drugs are administered through IV route, and this IV route is considered as the emergency route. Here these drugs are quickly absorbed, and drug shows the 100% of bioavailability. So this is considered as IV route is considered as the emergency route. Most of these antibiotics are administered diazepam. These are some examples. Intrathecal administration, here the drugs are injected into the subarachnoid space of spinal cord. Mostly this spinal anesthetics, this the one is the preferred route. And amphotericin B, this is an antifungal agent. This mainly used is intrathecally administered in case of fungal meningitis. Next one is the transdermal. Transdermal drugs are injected into skin. Examples are nitroglycerin and estradiol. Sublingual, this name is also indicate these drugs are administered beneath the tongue. For example, like this orbitrate, nitroglycerin, nifedipine, these tablets are administered beneath the tongue. That's the sublingual. Rectal administrations are example diazepam and aminophylline. Next we enumerate 4 newer drug delivery systems. Examples of newer drug delivery system, this prodrugs, transdermal adhesive patches, progestasert and ocaserts. What is prodrug? Prodrugs are this mainly is an inactive form. Is a inactive form, and when it gets metabolized or any biotransformations or chemical degradations occurs, this forms the active derivatives. So this active form shows the pharmacological actions. Examples are levodopa. Next come to this transdermal adhesive patches. Here the drug is held in a reservoir between an outer layer and a porous membrane. So these drugs are mainly inserted in the drug reservoir, and here drug is slowly diffuses through the membrane, and percutaneous absorptions takes place at a predetectable and controlled manner. The main advantages of this drugs are released in a predetermined and controlled manner, so these adverse effects can be minimized. Progestasert is an hormone releasing intrauterine device. Is mainly used for contraception. It is inserted into the uterus where it delivers progesterone constantly for over 1 year. Occlusod is an ophthalmic drug delivery system. When this kept under eyelid, this can develop steady flow through a membrane by diffusion at a steady rate. Examples are pilocarpine occlusod. This mainly used in glaucoma is placed under the lid and it can deliver pilocarpine for 7 days. So it's the best known ophthalmic drug delivery system. This can be overcome all the existing ophthalmic drug delivery. This like this eye drops. This eye drops mainly causes eye irritations and daily 3 to 4 installations are necessary. All these drawbacks of eye drops can be overcome with this newer drug delivery, newer ophthalmic drug delivery, this Occlusod. This inserted in our eyelid just like contact lens. Okay, thank you so much for your patient listening.